As I said before, many patients wouldn't have any symptoms due to their fibroids, and less than 30%, 30 or 35% of patients would have symptoms because of they have myomas. You may not know that you have fibroids, and you could get the diagnosis from a regular GYN checkup. You could go to see your doctor, and he or she could just diagnose them from the physical exam. Sometimes we will find in the physical exam that you have a mass in the abdomen that you never recognized before, or during the internal exam we could palpate your womb, your uterus, and find that you have a mass, a tumor, or irregularities because of the fibroids you have in your uterus. If we just add those physical exam findings to the symptoms that you may have, probably you can start thinking about that diagnosis. We can start thinking about that you could have fibroids. So from there on, we could maybe need some other procedures to find out if you have fibroids. We could have we could do an ultrasound, that is an exam based on waves that we could do through the abdomen or through the vagina, and that is going to let us know if you have some abnormalities in your uterus, and we could diagnose with a lot of precision if you have fibroids with that exam. Sometimes the ultrasound wouldn't be enough, and we could need some other diagnostic tools. We could use something called an MRI, a magnetic resonance imaging. That is a really specialized exam where we are gonna just look at the abdomen and try to figure that out, if you have fibroids, if they're big, or you have a lot of fibroids. The MRI could help us to get the diagnosis. You could also need an X-ray, a regular abdominal X-ray, or a CAT scan, CT scan. That would also help us to get into the final diagnosis. Some patients from there on could also need some other procedures. You could be asked to do a laparoscopy. It could be a diagnostic laparoscopy. That's a surgical procedure, the most of the times under general anesthesia, and where you're gonna get a little incision in your belly button. We're gonna put a camera inside your abdominal cavity, and we're gonna take a look at your internal organs, including your uterus, and we're gonna be able to see if you have fibroids or not, how big they are, how many they have, where they are located. The laparoscopy, I'm going to be talking about that a little bit later, but the laparoscopy, it's also a really useful tool because we're going to be able not only to diagnose the fibroids, but also we're going to be able to do surgery on them if you need them to get removed. So in the same procedure, we're going to be doing the diagnosis, and also we're going to be able to do treatment, as I'm going to just tell you a little bit later. And finally, you also could need something called hysteroscopy. That's also a surgical procedure. Could be done in the office or under general anesthesia in the hospital. And in that procedure, we're going to use a little small instrument. We're going to put it inside the cervix and then inside your uterus, and you're going to be able to see directly the uterine cavity. We're going to be able to see if you have fibroids inside your uterine cavity, those that I already named the submucosal myomas. And after the diagnosis, we're also going to be able to do treatment with that. So as we talked about with laparoscopy, with hysteroscopy, we're going to be able to do the diagnosis, and also we're going to be able to treatment.